Recently, we explored menopause and the far-reaching effects it can have on the body. And it is often said that the female reproductive system doesn't get enough attention and it can be quite mysterious. But the male reproductive system often doesn't get much of a look in either, and there are some aspects of the male reproductive system that can be a little mysterious. Today, I want to shine a light on one part of this system, the prostate, a small gland that's found in the male reproductive system. This gland, as well as playing a major role in reproduction, can also affect the urinary system too. So, if you have a prostate or you know somebody who does, then keep watching as we look at what it is, what it does, and what can go wrong. And do join me in part 2, where I'll be looking at some of the things that you can do to protect the prostate. As always, if you do enjoy these videos, don't forget to subscribe to our channel. It really does make an impact, and hit the bell so you're notified when we release part 2. So what is the prostate and what does it do? So the prostate is a small gland that forms part of the male reproductive system. It is worth noting that anyone born with male reproductive organs will have a prostate. For trans women who have undergone gender reassignment surgery, the prostate is not removed. It remains in place. Some intersex people and non-binary persons may also have a prostate. So the prostate can be found between the bladder and the rectum. Passing through it is the urethra, the tube that leads urine from the bladder out of the body. The prostate is also connected to the testicles via the vas deferens. These are tubes that move semen away from the testes. The prostate has 3 functions. So it produces and stores fluid that makes up part of semen. This fluid nourishes and protects sperm on its onward journey. The prostate also plays a role in the flow of urine through the urethra. And it enables the urethra to switch between passing urine and ejecting semen. During sexual arousal, the prostate helps to close the urethra to the bladder, preventing urine from leaking out. And during ejaculation, the prostate forces sperm and seminal fluid down the urethra out of the penis. So what can go wrong? As with any other gland or any other part of the body for that matter, for the most part, the prostate does what it does and requires very little support. However, there are of course some things that can go wrong. As you age, the prostate does become enlarged. This is pretty normal. From around the age of 50, the prostate can start to enlarge. Enlargement of the prostate is known as benign prostatic hyperplasia, and it is a very common condition. It's by far the most common problem to occur in the prostate gland. It isn't known for certain why this happens, but it is thought to be linked to hormonal changes in the amount of testosterone in particular. How much the prostate enlarges and the effect this can have can vary from person to person. As the prostate enlarges, this can cause pressure to build on the urethra, and this can result in urine hesitancy, a difficulty starting urinating. It can also result in difficulty passing urine whilst you're urinating, a frequent urge to urinate, and difficulty fully emptying the bladder. And this can be really disruptive. Many men find that they have to get up throughout the night to urinate. It can cause discomfort and it can even lead to the development of urinary tract infections, as urine that's left in the bladder can be a breeding ground for bacteria. If you experience any of these symptoms, you should see your healthcare professional. Whilst enlargement of the prostate is a very common occurrence, these symptoms may be a sign that something else is going on. So one concern is prostate cancer. Unlike some other types of cancer, prostate cancer can often be symptomless, although it may present similar symptoms to an enlargement of the prostate. And this is why it's essential to get your prostate checked if you're experiencing any symptoms. There is good news though. Prostate cancer is generally a slow-growing cancer and it's not considered aggressive. Often the first course of action will be observation and monitoring of the cancer, although surgery and radiation will of course be considered if necessary. Another thing that can happen to the prostate is inflammation. This is also known as prostatitis. Inflammation is quite different to enlargement. Inflammation is usually caused by an infection such as a recent urinary tract infection, pelvis injury, infections caused by the insertion of catheters, or even sexually transmitted infections. Inflammation of the prostate gland can be very painful, often much more painful than enlargement of the prostate. Inflammation can occur at any age, but it is more common in people over the age of 30. You are at greater risk of developing prostatitis if you have IBS or any other painful abdominal conditions, and you are more likely to get it if you've had it previously. It can keep coming back. There are two types of prostatitis. Chronic prostatitis is the most common type. With chronic prostatitis, the symptoms come and go over several months, often long after the initial infection has cleared up. Acute prostatitis is less common. This type can come on very quickly and it needs urgent investigations. So the symptoms of prostatitis to look out for are pain that can be sudden and severe, and this can be felt around the penis, testicles, anus, or even the lower abdomen and lower back. Prostatitis can result in difficulty urinating, and that can cause urine to build up in the bladder. This can be quite serious if it's not dealt with. Prostatitis also causes pain when urinating, and it may even cause blood in the urine. Like many infections, it can cause you feeling generally unwell, aches, pains, and increased temperature. And it can also result in pain when ejaculating. If you experience these symptoms, it is essential that you seek medical advice. Prostatitis can be treated, but it is essential to address it quickly before it could lead to any further complications. So now we understand a little bit more about this gland, join me in part 2, where I'll be looking at what you can do to protect the prostate, exploring dietary advice and lifestyle tips too. As always, don't forget to subscribe to our channel. It really does make a positive impact on our channel. And if you hit that bell, you'll be notified when we release part 2.